On Healthy You, we want to connect you to industry experts to help inspire you to live your very best life now through health and wellness. So this week's show is your everyday challenges, right? So for so many of you, that's about pain. Pain management is a serious struggle for so many people out there, and there are so many different fads and choices and beliefs. Now, we got a very interesting expert to speak to this week. He's an interventional pain management doctor. His name is Dr. Mukalel, and he really specializes in this understanding of pain management as so much more than just a prescription to solve a problem. Isn't that right?
Absolutely. Thanks, Brett, for having me here tonight. We're a special type of group of doctors who specialize in not just pain management, but a niche practice called interventional pain management. Well, what is that? The difference between us is that we don't start with the opioid. We start with an interventional therapy that can help diagnose your pain, and then from there we have options. Do we ablate the nerves? Do we neuromodulate the nerves? We have a lot of different things that we can do to help you resolve your pain patterns.
So what inspired you to look for alternatives to the standard opioid pain medication path that so many people go down?
You know, it's a tough situation for a lot of people to be in. But when I was younger, my father suffered with a lot of pain issues. He was on a lot of heavy anti-inflammatory medicines that eventually, after the course of 2 to 3 decades, caused him to have kidney failure. And then he needed a kidney transplant. So every medication you take has a side effect. And not everyone responds the same way to them. So when I was going through anesthesia training and pain management training, I saw these side effects, and I didn't want to be a part of that anymore.
So personally, I'm really inspired to hear that. My mother's struggling with kidney issues just because of too much ibuprofen over the course of her life. Now, what about, though, education, right? And when it comes to having people understand how to manage their pain, how important do you think it is to educate people about their pain and what they're going through?
Brett, that is the most important thing. As doctors, our job is to give the appropriate amount of education to the patients, because if they don't have the right information, then they can't figure out what's going on. But we're there to help. As doctors in interventional pain management, what we do is we're looking to help you solve your problems by educating you. An educated patient can battle or go to battle to any type of pain issues.
Well, listen, Dr. Mukalel, we're really excited to have you here this week. It is an issue that is truly important to so many people out there. We're going to check in with him throughout the show. We're going to talk about the differences between chronic and acute pain and all sorts of other great solutions. So thank you for being here. We're looking forward to it.
Thank you, Brett.
And again with our Healthy You expert this week. Now, it's a perfect time to do it. We're just talking about a TENS unit as a way to get real deal relief, as a way to combat pain without going to medication, maybe without going to a doctor, and seeing if you can help yourself get some real relief. Dr. Mukalel is joining us today, and he is a specialized doctor that is so very needed across this country right now. He works on what's called interventional pain management. So when we have an opioid addiction crisis going on in this country, when we're all trying to figure out what we should or should not put into our bodies, this man is focusing his medical experience and practice on coming up with solutions to take us away from going down that path. So thank you for all that you do. We really do appreciate it.
Thank you.
Now, in being here tonight, one of the things that we want to talk about, there's chronic pain, there's acute pain, but as a person who wakes up and is in pain, how do you know if you can deal with it yourself or if it's time to reach out to a professional?
You know, that's a great question. And the reason why is because if you're having pain and that pain is, let's say, occurring every now and then, and you've tried all these other modalities and it's not really helping you, you're not feeling like you're getting better, and now that pain is persisting past 3 months, as well as it becoming something that's limiting your ability and your activities of daily living, then it might be time to see a pain management doctor.
And obviously, when you go through that process, it's been several months, other modalities and options like a TENS machine, it's not working for you. Obviously, that's a scary situation. It's a stressful situation.
Absolutely.
Do you feel like stress only contributes more to people's issues of chronic pain?
One of the biggest differences, not only the time factor, but one of the biggest differences between acute pain and chronic pain is that there's an emotional component associated with the chronic pain. So imagine having an extra level of stress compounding that emotional level, worsening your chronic conditions.
Well, I think it's hard. We live in a society now where pain is almost shameful. It's hard for people to admit that they're in it. So when we have people that are willing to reach out and help us through the process, it's so incredibly important.
Absolutely.
Now, what about diet and nutrition? Can that actually contribute to or even help alleviate some pain?
Oh yeah, they definitely. there's a growing field of belief that inflammation is what causes all the pain throughout your body. And if you try these diets where you're using anti-inflammatory drugs, or anti-inflammatory diet where you're taking high omega-3s and raw vegetables and raw fruits, low red meat into your diet, these type of things can help decrease the total amount of inflammation in your body, which will subsequently give you some better relief.
Great tips, Dr. Mukalel. We really appreciate it. Stay with us. There's more to chat with you about. Okay, now here on Healthy You, we always want to check in with guest experts, people in their fields that can help to educate and inspire you. That's what we're here to do, to get you to live your very best life now through better health and wellness. And this week we're joined by a very compelling, interesting doctor. His name is Dr. Mukalel, and he's an interventional pain management doctor. Thank you so much for being here.
Thank you, Brett.
For anybody who missed our last hour, tell us again one more time, what is interventional pain management about?
Interventional pain management is modern pain management at its finest. We're basically finding targets in your body where we can do minimally invasive procedures to take away those pain generators so that you can have a more active, healthy, loving lifestyle.
Sounds pretty simple and pretty fantastic, but there's some pretty impressive science behind it. And you've talked a little bit about this idea of sort of pain modalities and modulating the perception of pain. Can you break it down for us to help us understand?
I'll tell you what I tell all my patients. Neuromodulation is one of my favorite things to do. Patients get so much relief from it. The nervous system in our body is the electrical conduction system in our body. The only way we can treat or repair some of the electrical conduction is by treating it with electrical conduction. Imagine if you're out with your child and your child falls and injures their hand. What's the first response by a parent? The first response is generally to start rubbing that hand or rubbing that injured area. Well, that rubbing sensation is creating pleasure fibers that are traveling up the arm, through the nerve, to the spinal cord, and to the brain. Now, instead of letting the pain receptors or the pain fibers travel up to the brain, we're rubbing this to create pleasure fibers to come up. Now, here's the thing that I like about it the most. We place it in your epidural space because as humans, we just can't rub fast enough or long enough to take away that pain.
Especially if it's chronic pain, right?
Absolutely, and it's actually used for failed back surgery syndrome, radiculopathy, and two other things that we talked about today. Diabetic foot neuropathy, peripheral neuropathy, excuse me, and even urinary incontinence.
So in our last moment, let me ask you one thing. What would you say to those who are struggling with chronic pain, tried several solutions, who feel like hope is lost and they just have to live with it?
Never give up. Always have hope. Modern medicine is here. You'll find an academic center or university setting near you and find an interventional pain management doctor who's going to be able to take care of you the way that you should be taken care of. You deserve a better lifestyle. You deserve a better life at this point.
Dr. Mukalel, thank you so much for being here. It is such an important topic in our world right now. We're trying to combat the opioid addiction problem. We so welcome you on this show, and I hope you come back and talk to us more in the future about your practice, okay?